Many frontline doctors are suffering from ongoing distress following the first wave of the pandemic. A study found that as the pandemic first accelerated, almost half of doctors reported psychological distress. At the peak of the first wave, nearly a quarter of doctors surveyed displayed symptoms of trauma. Once the first wave of the pandemic had ended, 10% of doctors were left with symptoms consistent with post-traumatic stress disorder. We're joined now by GP Dame Claire Gerada, Medical Director of NHS Practitioner Health and Chair of the charity Doctors in Stress. Claire, great to have you on the programme this morning. 1 in 10 suffering PTSD. I suspect that those numbers are not a million miles away from the levels of PTSD experienced by members of our armed forces that have spent time in a combat zone.
I think you're right. And it's not just doctors, by the way. The research was done on doctors, but there's a report today about call handlers, so people who answer the phone for 999 who are suffering immense distress because they can't get ambulances to people as quickly as they want to. And I think it is right across the NHS and care staff. I think many are suffering from symptoms of PTSD, so that's severe anxiety, nightmares, flashbacks. But also at the other end, there's feelings of exhaustion, feelings of guilt at not being able to do enough. And what people do, and you have that piece about teachers are the same. What we tend to do when we see all around us is in slight, disarray, is we work harder, we try and fix it, and we give more of ourselves, which is what the Hippocratic Oath, in fact, asks us to do. And we get more and more exhausted. And unlike if you're on deployment, for example, in the army, there isn't a time where you can just down tools, rest and recuperate and go back. It's just a constant, relentless work, which I think now is beginning to have its toll on probably the most resilient of all the workforce, which are doctors.
Of course, and you would expect doctors, knowing far more about mental and physical health than lay people like myself, you would immediately assume that they would be in a perfect position to identify when things were going wrong. But as you mentioned, that sense of guilt perhaps plays into the fact that many of them will not be talking about this as openly as they perhaps should.
And thank you for saying that. No, doctors are terrible at recognising distress themselves. They're far better at dealing with it in their patients. And they may recognise it if they're having to stop the car and burst into tears, or they're feeling, tightness of the chest as they walk into work, which is a symptom of anxiety. But usually it requires somebody just to tap on their shoulder and say, listen, are you all right? You don't seem all right. And actually, what we need to be doing is metaphorically doing that to us all. We need to be all asking each other, how are you? And really, honestly, waiting for the answer. And those doctors and nurses, whoever, who are feeling distressed, who are feeling they can't go on, help is at hand. I mean, talk to your peers, talk to your colleagues. But if you go onto the Practitioner Health website, that's practitionerhealth.nhs.uk, or Doctors in Distress, you'll see a whole suite of services, right from groups which Doctors in Distress is trying to set up for everybody, but right through to treatment services. So please, if you're a health professional, this isn't the time to be proud. This isn't the time to say, well, stiff upper lip. This is the time to accept that you're just human, and that if you need help, receive help, get it.
Dr. Claire Gerada, great to have you on the programme this morning. One hopes that the doctors listening will heed your advice. Thanks for being on the programme.
Thank you very much. Keep well.
You too.